All right, and we are going to ask you all to stay muted. If you have questions, please submit them to the care team at Join Belle, and we'll hit them during our live sessions. But let's go ahead and get started. So welcome, I'm Megan Ostler. I'm the registered dietitian with Belle, and today's topic is something that nearly everyone experiences on GLP-1s, at least for a little bit of time, and that's side effects. So the goal is to help you understand what's happening in your body and to give you realistic ways to feel better as your body transitions. Okay, so before we dive in, I always start every single one of my sessions, whether I'm working with a client one-on-one or I'm teaching a group class, I start every session with wins. It's not because I want to ignore what's hard, but because the human brain naturally pays more attention to what's not working. And when we pause to name what's going well, it shifts our brain out of threat mode and into growth mode. So studies show that these positive reflections activate the prefrontal cortex, and that's the part of your brain that helps you to learn, adapt, plan. I find that when I do this with my clients, their problem-solving skills skyrocket and they are far more consistent with their habits. So these small wins give you a little hit of dopamine, not from big achievements, but from that consistent effort. So the same reward pathway that helps those habits stick. So here's the cool part. Every time we celebrate these wins, we're training our brain to also notice them. And it helps us to see progress and not get stuck in that all or nothing or perfectionistic type mindset. So I am going to start a timer and I want you guys to think of some wins. What's going well? What's something that you did well this week, right? Even if you can name 10 things that you didn't do well, name one thing that you did do well, that you showed up for yourself. Okay, so you have 60 seconds. Think about that. Okay, thank you guys for doing that with me. I know sometimes it can be hard to reflect on what's going well, especially if you're in the midst of side effects and feeling like, I don't know if anything's going well. But these small moments, they help to build self-efficacy and this belief that you can do this. It's going to help you through this journey, and you're going to believe that you can have long-term success, and you can. So we're going to be starting every live session with that. And when we do, we're not ignoring the struggle. We're giving your brain proof that progress is happening. And that's what's going to keep us moving forward. All right, so let's move on. We're going to start this live session with a little mini course. So every live session will have a little mini lesson. We're going to go deeper into those lessons in the 12-week Thriving on GLP-1s, but we'll have review lessons or maybe deep dive into specific topics during these lives. And then we're going to move on to the Q&A portion of them. So first off, managing GLP side effects. Let's talk about this. If you're experiencing nausea, constipation, diarrhea, fatigue, or just not feeling like yourself, you're not doing anything wrong. This is really normal. They're usually temporary adjustments as your GI system slows down, your appetite signals regulate. Because GLP-1 medications mimic a natural gut hormone, the glucagon-like peptide 1, we're going to regulate that blood sugar, slow gastric emptying, but this can also increase fullness and it can throw off our GI system a little bit, but it's how these medications work and why they're so effective for weight loss. The challenge is the adaptation phase. So your body might just need a little extra support for a few weeks, a little more hydration, a little bit more mindfulness with meals, potentially a few nutrients adjusted, right, to help. But studies show that around 40 to 50 of people, or 40 to 50% of people who experience these GI symptoms early on improve, usually within the first few weeks. So not everyone experiences GI symptoms. If you haven't and you are feeling fantastic, that's awesome. I'm so happy for you. If you are, please know that you're not alone. Lots of people will, and it will get better. And there are certain things we can do to help make that transition a little bit easier for you. Okay, so when we stay well-fueled, hydrated, and we give time to just settle in, the results are going to become more sustainable long-term. So in today's session, we're going to walk through what's common, why it's happening, and how to help ease. So first off, how common are these? In large clinical trials, nausea was the most common side effect. So if you've experienced that one, you're in good company. Followed by constipation. The opposite of that, diarrhea can also happen. Vomiting occurs in about 1 in 5 people, usually right after a dose increase for like a day or two. But these symptoms typically improve as your body adjusts. So you can see that the average time usually is a number of weeks, maybe even days for things like vomiting, and then things will get improved. The one that doesn't necessarily improve and that may persist or even worsen with time is constipation. So that's one that's not your body necessarily adjusting. It could be exacerbating an underlying condition, especially if you've already struggled with constipation. So don't expect this one to just get better without you doing anything. This one does need some intervention. All right, but first we're going to start with managing nausea and vomiting. So nausea and vomiting are closely linked to meal size and fat content. So we can help alleviate some of these symptoms with those two things. Smaller meals, lower fat meals can really help. Hydration also plays a major role. So when GLPs slow the digestion, fluid can sit in your stomach longer. This can make drinking large amounts really uncomfortable, can lead to some reflux potentially for a lot of people. And sipping small amounts of meals between the day can help keep your hydration levels up. And clinical studies show that dehydration is one of the strongest predictors of nausea and fatigue on GLP-1 medications. So staying hydrated is not just about comfort, it's about alleviating some of these symptoms and also supporting your kidney function, your blood pressure regulation, your energy, and making it so you can stay on these medications longer term as needed, right? So you don't have to give up after a few weeks. So hydration is a big one for this. Typically cold or room temperature fluids feel a little bit better, but some people like hot ones too. They might be more settling. So try both, see what works for you. You might try like just plain water or dilute it with electrolyte mixes, add in a little juice. Herbal tea, especially ginger, can help with nausea. So that might be one to try. Peppermint can work for some people unless you're having reflux, in which case peppermint might actually make the reflux worse because it can loosen that esophageal sphincter. So peppermint, maybe. I would try ginger first. And then carbonated drinks can actually make this worse too because of the bubbles, right? If we're already overly full, we're already experiencing nausea, maybe a little reflux, hopefully not vomiting, but maybe, then the carbonation can put more pressure on our stomach and cause more reflux and potentially more vomiting. So I would stay away. If you're experiencing nausea and vomiting, I would actually stay away from carbonated drinks for a few days and see if that helps because they could be contributing to this. So just avoid the bubbles for a little while. If you're not experiencing this, you don't need to avoid bubbles. There's nothing wrong with carbonated drinks. And in fact, carbonated water is just as hydrating for people. It's just if you're experiencing these symptoms while the early phase of medication and you're adjusting, avoid the bubbles for a little while. And then if you want to go back to bubbly water, that is absolutely fine. It is just as hydrating, so we can do that. One thing though is that it can cause, if you already have overactive bladder syndrome, carbonation may worsen that. So just keep that in mind that again, if you're having a hard time with hydration, or if you're peeing all the time and you're like, oh, I don't like drinking this much water and I have to go to the bathroom all the time, then maybe also stay away from carbonation for that reason and see if it helps you be able to go longer stretches between going to the bathroom. But I generally recommend aiming for around 70 to 90% of your total fluids per day. But keep in mind that that doesn't have to be straight water. So 70 to 90 ounces, and that can be coming from broth, electrolyte drinks, even high water foods like milk or fruit or things like that. So remember, we're just trying to be consistent with our hydration. We're trying to increase our hydration, but we don't have to hit that number every single day. It's just kind of an aim. The bigger goal would be let's sip every 15 to 20 minutes throughout the day. Because if we're trying to drink tons of water all at once, it's probably not going to work very well. It might increase nausea, vomiting, and reflux. Okay, now managing GI symptoms. So these ones can be a little bit more uncomfortable than the nausea. Maybe not the vomiting, but the nausea. So let's talk about this. So diarrhea is often just your gut adjusting to that slower digestive rhythm and the dietary shifts that might be coming as you're not tolerating certain foods. So if diarrhea occurs, really what we want to do is reduce very high fiber or greasy foods early on. This should get better in a few days. We want to focus on hydration, balanced meals. Again, we're thinking every 3 to 4 hours we're eating, every 15 to 20 minutes we're sipping. We're just supporting that GI system with really small amounts to keep everything moving and feeling good. So most cases are going to resolve pretty quickly without medication changes. But if it becomes totally intolerable, then we can reach out to Belle. You can decrease your dose or things like that. But the most important thing you can do, again, is to prevent dehydration. With diarrhea, you're going to be losing electrolytes, so you're probably going to want to replace those electrolytes. Oftentimes, we can do that through diet, but if we're having diarrhea and not tolerating a lot of food, electrolyte supplementation is a great option. So I would say add in electrolyte drink mixes, choose low sugar electrolyte drinks, replenish that sodium and potassium, which are going to be lost really quickly with diarrhea. And then keep your meals really bland, low in fat, and choose easy on the stomach type things. Typically oatmeal, bananas, yogurt, soup, those are all typically fairly easy and they're going to help with diarrhea. Bananas specifically can kind of help thicken stools a little bit without medication. So that one would be one that I would try. And then the other side of that, which I actually see this one far more often with my clients, is constipation. So because the medications are naturally slowing everything down, it makes sense that constipation would start and or worsen. So especially if you have experienced this previously, it might be exacerbated by GLP-1s. That doesn't mean that you can't take GLP-1s, and that doesn't mean you're doing anything wrong. We just need to adjust a little bit. So about 20 to 30% of people are going to experience this, and it can persist. It can worsen with time. So again, we don't want to ignore this one. We actually do want to do some interventions with it. But the key is to gradually adjust. So we want to be focusing on fiber and water. But fiber, if eaten too quickly and ingested too much, can actually worsen GI symptoms. And if we're not getting enough water with that fiber, it will make constipation worse. Fiber works through water. It attracts water, and then insoluble fiber helps to move things through. Soluble fiber uses that water to create a gel, which then helps bind up waste and things like that. But fiber can't do its job without water. And so if we don't drink enough water and we increase our fiber, we're actually going to cause more blockages and more problems. So we want to make sure we're drinking a lot with this and increasing slowly. I always tell my clients to think of fiber as the food for a microbiome, because that's what it is. It's the food that we don't digest, but the microbes in our GI system do. And they all have different food preferences, just like you and I. The problem is that if we flood our system with a certain type of fiber or any fiber, and there's not enough microbes to break that fiber down, then it just sits there, not getting eaten by those microbes, and it ferments and causes more gas, more bloating, more pain, and more problems. So we need to give our body time to adjust. We need to give those microbes time to eat, reproduce, and become more robust in our GI system. And then when there's more of them, they can tolerate more food. So usually what I say or tell my clients is to increase your fiber by 2 to 4 grams and then hold that for a week or two. So if you're currently eating 15 grams of fiber, which is the American average, maybe this week you're going to try for 17 grams, and then you're not going to change that. You're going to do 17 grams every single day for a week or two, and then go up to 20, hold that for a week or two, and 23, hold that for a week or two. Again, we're trying to give time for those microbes to reproduce and to our body to adjust so that we can handle more fiber. We want to work up to 25 to 30 grams. If your calories are on the lower side, 25 is fine. However, above 30 grams is really helpful, especially as we wean off. So working up to 5 or to 30 grams of fiber daily is helpful. And then other things that help with constipation are going to be movement. So including some movement. Research shows even 15 minutes post meals can be really helpful. You may try supplementation or magnesium citrate or things like that that can help to move stools through, but make sure to talk to your doctor before doing that. The fiber supplement that I typically find most helpful for clients that they tolerate well and it works really well for them is usually psyllium husk. But again, we want to make sure that we're not introducing anything that is contraindicated. So make sure to talk to your doctor before you start increasing magnesium citrate or things like that. Okay. And then our next one is managing fatigue and low appetite. So this one is also really common because GLPs naturally reduce our hunger and slow digestion. That also means that we're getting less food, and that can really impact our energy and lead to a lot of tiredness, muscle fatigue, things like that. However, again, the clinical studies show that while this might affect about 20 to 25% of people, it usually peaks within the first month and then alleviates. So if you're in your first month of GLPs and you're like, I'm so tired, know that this is going to improve. So after about 4 weeks, it will improve. The other things that help to improve this is, again, steady fuel. So we want to make sure that we're not contributing to those energy dips by not eating enough food. We want to make sure that we're creating a small calorie deficit, but not so much of one that we can't maintain it and that our body doesn't have the fuel it needs to thrive. And we talk a lot about this in the Thriving on GLP-1 medication. So be sure to check out that course and that'll walk you through more of how to do this. But generally speaking, I recommend mini meals. So if you can eat something, something's going to be better than nothing every 3 to 4 hours to keep our amino acid pool steady, which we talk a lot in lesson 2 about, and to help support that energy and stabilize those blood sugars and help with cravings and nausea later on. So really thinking of, okay, I don't want to eat necessarily, but I need to eat something. This is going to help with my nausea. This is going to help with my fatigue, and I'm going to feel better if I do. So even if you don't feel like eating, please prioritize eating something, ideally something with some protein and fiber, but something every 3 to 4 hours. And then remember, hydration as well also impacts this. Dehydration can drop our energy by about 10 to 15% by itself. And so we want to make sure that our fatigue is not being exacerbated from dehydration. And then a little bit of exercise. I know it sounds counterintuitive, but a little bit of exercise can help to keep us feeling more energized. So if you're having a really low fatigue day, if you can, now I know if you're in the middle of like nausea and vomiting, this may not happen, but if you can tolerate it, like a few sips of water, a walk around the block can really help to bring back that energy, help with dehydration, and help manage that fatigue and low appetite. Okay. So the next question is, all of these are really common, but when do they become too problematic? I always tell my clients that your body is just giving you feedback. It's not telling you you're failing, it's just feedback. It's really normal to experience these mild digestive changes, but there's a line when that feedback becomes sirens, right? When it's over stressing your system and you do need to call your healthcare provider. And those would be if vomiting is lasting more than 24 hours and you can't keep any fluids down, then it's time to call your provider. Prolonged dehydration can really strain our kidneys and it's going to make it harder for us to tolerate the medication. So if this is happening, call your provider. There are things that we can do as far as hydration, reestablishing hydration through IVs or things like that, decreasing medication, even nausea medication can be added to this, right? If persistent or severe abdominal pain is happening, especially if it's radiating to your back or accompanied by a fever, then that one I would also say go see your provider. Rarely, very rarely, GLPs can be linked to gallbladder and pancreatic inflammation. So it's better to just check. It's better to just make sure that that's not happening. It might just be gas, it might just be constipation, but if it's severe, accompanied by a fever or radiating to your back, I would go get that checked out. And then if you're losing weight too quickly, if your energy is just plummeting, and initially you might lose quite a bit of weight on a GLP-1 medication, but if you're losing 3 to 5 pounds a week after the first month or two, and you're consistently losing that much, that's going to be a sign that you are losing too much too quickly. You're not eating enough. We're at severe risk of malnutrition, and we need to adjust So it might be adjusting the dose, it might be adding in an anti-nausea medication, but we don't want to be losing that much weight continuously long term. That's a little bit too fast. And then finally, reach out if you are having problems and you're tempted to skip an injection, or change your dose. Make sure you talk to your provider before doing so. These metabolic medications are really, really powerful, but we're here to help you so that you don't need to do this on your own. We can teach you how to do it safely, sustainably, how to adjust. But the big takeaway here is don't white knuckle through this, right? We have early communication, reach out to Belle, reach out to your doctor. We're here to support you. And if you have questions, let us know. Speaking of questions, we are now moving on to the question and answer portion. So each week I'll be taking a few of the questions submitted by you guys and answering them. If your question isn't answered, stay tuned. We'll have a queue that we're going through. If you want to submit questions, then email care@joinbell.com and it'll be added to the following week's queue. And then if it's something really personal, we may not address it on here, but we will address any questions that can be helpful to others. All right, so one of the questions we got is, I'm having a hard time drinking so much water. Is it okay to add flavor packets? And the answer is yes. Flavor packets, electrolyte mixes, a little splash of juice, whatever you want is totally fine. The goal here again is hydration. So looking for options with less than 5 grams of sugar might be helpful. A lot of sugar can make diarrhea and GI symptoms worse. So I would choose one with a little less sugar if you can. You might try adding in like half a packet or mixing it with more water if it does have more than 5 grams of sugar in it. So we want to keep this kind of light. And then you might consider electrolytes as well, especially if you're having fatigue, diarrhea early on. In fact, in randomized controlled trials, the hydration was shown to really, really help. So adding electrolyte packets into water was shown to help with GI symptoms during that first month or so of starting GLP-1 medications. Now, you're probably going to want to avoid a few things though, if you're not tolerating them. Now, I'm not going to tell you to never drink caffeine again, but pay attention to if caffeine is making this worse. Caffeine in itself is not super dehydrating. Although it's a mild diuretic, it's not going to dehydrate you. It just might make things worse with your GI symptoms. So if you are tempted to turn to a lot of caffeine, just pay attention to how your body's reacting to that. Is the caffeine, after you drink something with a lot of caffeine, is that contributing to poor sleep, which is impacting your fatigue? Is it contributing to more diarrhea, more GI upset? So really, these are just areas to pay attention to. You do not have to eliminate them. On that same note, artificial sweeteners or alternative sweeteners, even natural ones like sugar alcohols or stevia or things like that, they may not be super well tolerated during this titration phase. And so if that's the case, just pay attention to it again. It's not that you have to eliminate them, but pay attention to if they're causing issues for you. And these are going to be found not only in electrolyte packets and things like that, but also in like protein shakes and stuff like that. As our bodies adjust to these medications, sometimes things that we were really mildly sensitive to before become bigger issues during the early on phases of this. And so if sugar alcohols were maybe causing a little bit of GI distress for you before, they might be causing a lot now. So paying attention to that and seeing, okay, if I drink this, is it worsening my symptoms or not? Can be helpful. And then again, if you're having a really hard time drinking enough water, try to do it outside of your meals. Usually my clients tell me I just can't drink that much when I'm so full from meals. And that's why sipping in between meals can be really helpful, because it's really hard to drink more water if you're already full from your food and you're having reflux and things like that. So again, maybe separate food and water if needed, but feel free to add flavor packets to add flavor. Just keep in mind, there could be ingredients that you're not tolerating now. So pay attention to those. All right. How many times a day should I be eating on a GLP-1? I forget to eat sometimes. This is super common, especially when those hunger cues go down, that food noise is silenced. Sometimes we do forget. But when our appetite drops, we want to be really careful not to skip meals. So that's going to worsen nausea and fatigue if we're skipping meals frequently. So again, aim for 3 to 4 meals a snack or so every 3 to 4 hours. Even if it's something really, really small, these consistent meal patterns are going to help stabilize the blood sugar. You're going to decrease GI symptoms, and it's going to help with fatigue. So even if it's like a handful of nuts or a protein shake or some Greek yogurt and a little bit of fruit, small portions are fine, but try to eat every 3 to 4 hours. And if you want more help with this, we cover it more in that Thriving on GLP-1 12-week course. Okay, the next question, which I hope we already covered this enough, but how can I avoid constipation? So again, I hear this a lot. We're going to be talking fiber, water, movement. Those are going to be our 3 superpowers with constipation. So because we talked about this a lot previously, if you have more questions, we will be doing a deep dive into this on lesson 3. And so going into specific types of fiber, what to be adding, how to help with constipation, how to support our GI health during this. But again, remember, we're adding fiber slowly, about 3 grams, holding that steady for a week or 2, and then slowly building up to 25 to 30 grams every single day. Prioritize products that are high in fiber. Things like whole grains, nuts, seeds, beans, legumes, fruits, vegetables are all going to be helpful fiber additions. If you are not tolerating them well, if that's not enough, if you wanted a little bit of support, psyllium fiber, again, is the one that I find most of my clients tolerate best. So that could be a way to just add in a little bit of extra help. But again, we want to make sure, I don't know all the medications that you're on, so make sure to talk to your doctors so that we can ensure that there's no contraindications or potential interactions. So before you start any new supplements, I would talk to your doctor just to make sure, because again, I don't know the medications and things like that that you're on. But psyllium fiber might be a really helpful one if you can't get it from food. Again, food first if you can. All right, should I still be taking my multivitamin? Yes, you can do that. Your daily multivitamin can be super helpful as long as, again, you've cleared it with your doctor, you've made sure that there's not going to be any drug nutrient interactions, then you can absolutely continue taking these. And you may want to take them with food, especially if you're having nausea, and especially if you're taking fat-soluble vitamins. We're going to want to make sure that those are being able to be absorbed. And we need about 10 grams of fat in order to absorb fat-soluble vitamins. So if you're taking a multivitamin that has A, D, E, or K in it, make sure that you're eating a meal that has at least 10 grams of fat with it. And again, seeing if that helps with the nausea, but it's going to help with absorption. If you cannot tolerate that, maybe break it in half. If you can only tolerate like 5 grams of fat at that meal, maybe break your medication in half if you can. I know not all of them are being able to be separated very easily, but if it's like a hard pill or something, maybe taking it at 2 different meals could be helpful. And then you might want to separate supplementation from injection day. If on injection day you're having a lot more symptoms, maybe just skip that day if that's going to cause more GI stress, because some multivitamins, especially if they have minerals in them, like iron, things like that, can actually worsen constipation, worsen GI symptoms. And so you may need to skip it for a day or 2 as your body adjusts just right around injection day. But there's no evidence to support that GLP-1s like make it harder for you to absorb nutrients. So it's not like you need to add in a supplement. However, if you've already been taking one, you're tolerating it well, especially if you have a documented history of inadequacy, right? Like if you have a low vitamin D intake or you've really struggled to keep your iron up, you have anemia often, things like that, I would definitely continue taking those medications, just knowing that you may need to adjust timing, dose, maybe skip a few days around injection, and then pay attention to if we actually need to add in any supplements. And that can happen with vitamins, minerals, especially if there's foods that you're no longer tolerating. So for example, a lot of my clients on GLP-1s really struggle with fat intake, and it can make it really hard for them to absorb enough vitamin D. And we may be needing to add more vitamin D in the form of a supplement. There also could be foods that you're not tolerating. So sometimes, like I said, things that were a little bit irritating to your GI system can become more irritating to your GI system. And so if dairy is one that you're struggling with, then you may want to consider, okay, what nutrients was I getting from dairy, and do I need to add those in the form of a supplement? Thinking about like vitamin D, calcium, potassium. Are we getting those enough from other foods? without the dairy, or do we need to add in a supplement? So those would all be questions that I would have around taking vitamins and supplements on these. All right, the next question is, I feel nauseous for 24 to 48 hours after injection. What should I eat? Again, stick to the plain, bland foods. Ideally, some protein. We want to help spare that muscle. So ideally, we're going to want to decrease or increase how much protein we're eating. So if you can, high protein, but easy to digest foods. Think things like eggs, yogurts, broth-based soups, like bone broth, things like that. Can all be things that can help bump up our protein, but be pretty easy on the stomach. We're likely going to want to move away from solid sources of protein and more into liquid type ones, like bone broth. Cold meals are often a little bit easier when we're nauseous, but just trial out. You're probably going to want to do low fat for a few days, but try to eat every 3 to 4 hours. Okay, do I need to follow a special diet like keto or intermittent fasting? Short answer is no. Special diets are not required. The GLP-1 medication, the great thing about it is that it's going to help decrease that food noise and make it so that you can just follow a normal, generalized, healthy diet, right? Now, we do want to pay a little bit more attention to like protein and fiber and things like that, making sure our nutrient needs are being met, but we don't need to follow any specific diet. And in fact, diets like keto or intermittent fasting can make symptoms worse because really high fat intake is probably not going to be tolerated, and skipping meals is likely going to contribute more to constipation, fatigue, nausea. So I would actually not do those and instead just focus on what can I add to help alleviate symptoms and help maximize my nutrient intake. And again, we'll cover that more in the 12-week course. Okay, so this week, your weekly focus is to pick one small action and focus on that. So we're not trying to overhaul everything. We're just picking one thing. If you're struggling with a symptom, then pick one thing that might help with that. Maybe it's going to be eating protein within 2 hours of waking up and continuously eating every 3 to 4 hours to help with that nausea. Maybe it's going to be increasing your fiber intake by 2 to 4 grams this week to help with constipation. Maybe it's going to be adding an extra glass of water to your lunch or around lunch, right? Whatever that looks like for you, pick one thing that you want to work on this week, jot that down, and then stay tuned for a 12-week course where we will be going into each of these things in more depth. Okay, so remember, as we wrap up, side effects are temporary. Your body is just learning this new rhythm with GLP-1s. You're not doing anything wrong. And when we support our body through this transition with hydration, small meals, a little bit of patience, right? Maybe tweaking meals a little bit to have a little less fat, things like that. It makes it so that they become really sustainable. You're able to stay on these medications for the duration that you need to, and feel good while doing so. All right, so I'll see you next week, but until then, keep focusing on the one habit that you sent and be consistent with that so that you can thrive on your GLP-1 journey. Thanks so much. We'll talk soon.